You're listening to an archived Cabral Concept podcast. After listening to this show, check out the most up-to-date podcasts available at stephencabral.com/podcasts or search directly on iTunes. And now, welcome to the Cabral Concept, where board-certified naturopath and integrative health practitioner Dr. Stephen Cabral shares how he was diagnosed at the age of 17 with a life-altering illness and given no hope for recovery. It was only after studying and traveling all over the world did he discover how to combine ancient Ayurvedic healing practices with state-of-the-art naturopathic and functional medicine to fully rebalance the body and re-energize it with life. It's time to discover how to get well, lose weight, and finally feel alive again. And now, here's your host, Dr. Stephen Cabral.
And on today's Cabral House Call, we're actually going to take 3 of your questions kind of straight across the map, covering many, many different things. And I'm answering this right before I'm about to go into a wellness client appointment. So, new wellness client appointment, I probably see 1 new person a day, maybe 2 at the max, just because of time constraints. But I'm looking forward to bringing you this show before I go in and do that consultation. So we're going to make it quick. We're going to make it to the point, and I'm going to answer all of those questions as succinctly as possible. Okay, first question is from Susie. Susie's asking, I have a brown mark on my upper lip, and it's not here. Is it hormone related? If not, what is it? Okay, so this is not the first time I've seen this question. It is actually quite a common question that does come up. I've seen it about maybe half a dozen times in my practice. Sometimes it's actually confused with what's called melasma. And melasma is a little different. I've seen melasma happen actually because of a really high stress response, a greater output of what's called cortisol and a greater output of what's called aldosterone. You see these patches sometimes happen with people with Addison's disease, which is kind of like this big drop in cortisol as well. And so that's hormone related in and of itself. That's stress hormone, and that can cause it. But typically not just on the upper lip. There's usually other patches on the body, sometimes on the hip, sometimes around the waist, and sometimes on the elbow. Now, women during pregnancy can get melasma, or sometimes called the pregnancy mask, that typically goes away when hormone levels return to normal. So you ask, is it hormone related? It certainly can be. It could be higher estrogen to progesterone-based ratios. That's absolutely one possibility. It could be adrenal-based possibilities. That is absolutely possible as well. Another is it can be caused by the sun, a change in melanin in the skin, absolutely possible. And the other way that I've seen it is from improper detoxification, kind of like a build-up in lymphatic-based fluid and tissue. Very uncommon to see just on the upper lip. However, the upper lip is most common when seen directly with hormone-based, whether it be adrenal-based. I'll tell you one other time. Okay, one other time there is this specifically, and that is digestive-based. So digestive-based, it is certainly possible with a sluggish digestive system that they've shown in Eastern-based cultures that tied to the lip as well. So do look into those all specifically, do begin to correct those, and then hopefully that patch does start to lighten as you improve your detoxification. So of course, you can absolutely, and should. I mean, for hormones, for inflammation, for digestion, for all of those things, I would simply start with the digestive-based. I would do a 21-day detox, a full detox. You're obviously welcome to use the Dr. Well Detox or another functional medicine-based detox program that works on phase 1, phase 2 liver detox, has you on predominantly a more vegetarian-style diet with more plant-based foods as well. So let us know how that works out for you. We'd love to hear an update on that as well. All right, question 2. Question 2 comes in from Jen. Jen's asking, what's better for energy during longer run and bike workouts? I currently use goo packs and different sugar-based solutions. Should I use that or another caffeine-based substitute? Okay, so I work with a lot of triathletes and endurance athletes and professional athletes. So what I say is this, the goo packs, although they serve a purpose, right? So they're very tiny. If you don't know what I'm talking about, they're only like 2 inches long by maybe like, I don't know, 1.5 inches or so wide. And they provide maltodextrin and sugar. They're sugar, and they're usually mixed with caffeine. A lot of people buy them that way. Great for triathletes. You can tape them to your bike. You can keep them in a little, pouch in the back of your shirt or anything like that. Okay, so you take maybe a glass or 2 of water, and you're going to have a goo pack at the same time. Well, The issue with me, for myself personally, has always been digestion based, and then also the quality of those. They're just very low quality. They have a lot of preservatives and things that I would rather not be in there. And so when someone's also asking about caffeine, and they're talking about, the question was longer and asked, should I use caffeine instead? Well, if you're going to be using caffeine, or should I use coffee instead? Should I use caffeine anyways? Well, if you're using caffeine, then, and you're going to do it anyway, and green tea is not enough of a caffeine stimulant for you, then coffee would probably be, an organic coffee would be a better solution for you. And the reason is this, that at least with coffee, if you buy an organic one, you're going to get a clean source, and you're also going to get the antioxidants along with it. You're not just going to get straight caffeine with like the preservatives in the goo pack. Now, the issue you run into is that you can only carry so many bottles and so many drinks and things like that on your bike. So it really depends on how long your run is. When working with endurance athletes and their nutrition, we typically say if your event or your training is 90 minutes or less, you can really just have whatever you need before your workout, before your run, before your bike, and you don't need to have it until then you finish. Now, if your bike or your run is 2 hours or more or longer, you're probably going to need a solution after about 60 minutes or so. And maybe that is 16 ounces or 20 ounces or whatever it might be on your bike. Obviously harder to run with that, of course, unless you're wearing one of those Camelbacks or something like that you can drink from. But that could certainly be a solution with a little sodium, a little sugar, and a little caffeine as well. So my thing is this, and my recommendation is never make this change a week or two out from a race. Try it a month out or two before and start to experiment with other things. But if you're asking for what's healthier and I have to choose between the few, well, an organic coffee for caffeine or green tea is going to be much healthier than a preservative-based goo pack with caffeine. And then you can get your sugar from many other different solutions. It doesn't have to just be from, again, those goo packs. It could actually just be from a more natural formula that you do put in your drinks. Okay. And again, that could be, fruit juices and things like that. Again, depending on how your body handles it. Okay. So Anna is up next. Anna's asking, what's your opinion on collagen powder drinks for joint pain? Okay. I could not take out this question, even though we reviewed it yesterday. So, Anna, hopefully you tuned in yesterday, and we recommended a product called Great Lakes Collagen, and it's a powdered collagen drink. We talked about how it can work very well for not only joint-based pain, discomfort, and really kind of rebuilding that joint a little bit with protein-based amino acids, but also we talked about it in terms of rebuilding scare, that's hair and skin combined into one word, also for your digestive system, also for detoxification because it's high in glycine. But one thing I didn't mention yesterday, and that's why I did want to also answer this again today, is that they're showing that collagen-based powders are actually working even better when combined with some vitamin C. So when it's used with vitamin C, not only does vitamin C also improve, of course, detoxification, its antioxidants, and its role in phase 1 detoxification for the liver, but vitamin C also in its own right can rebuild skin, hair, nails, tissue, joints, all of those things as well. And a lot of times with joint-based issues, there's bacteria, there's other stuff in the joints that needs to be cleaned out. So, okay, I'm recommending that you absolutely can use collagen powder drinks for joint pain. I would recommend using some vitamin C with that. If you haven't tried a product that combines glucosamine, MSM, and chondroitin, I would do that absolutely as well. Typically, most products for that have a standard dose of 1,500 or so plus milligrams of glucosamine mixed with, again, you're looking at MSM, which is going to be a great way to help detoxify too. It's a sulfur-based product. And with that, then start to really look at the joint pain. Is it biomechanical, meaning like you're not in proper order because you're tight, everything, your fascia is locked up in your muscles? Or is it inflammation based? Like, should you be using more omega-3s, an EPA-based omega-3? So you have to look a little bit deeper. Don't just look at collagen for joint pain. But of course, if you have osteoarthritis, well, the glucosamine, the chondroitin, the MSM, a little vitamin C, plus this collagen powder could potentially do wonders for you. Now, keep in mind, all of these things have shown to be given the most benefit after using them for 6 weeks or longer. So if you're looking for a quick fix, that's challenging. A quick fix is going to come from detoxifying, decreasing inflammation, improving your omega-3s. That's a faster one, but the longer one, which is, definitely the longer game is what you want to play, is that you're going to want to use these things to help try to rebuild the joints as much as possible. So Anna, hopefully that that answered your question specifically. Great questions today. Keep them coming. And believe me, I'll be back tomorrow answering more of your questions on everything from nutrition to exercise to anti-aging to weight loss. So looking forward to those calls as well. Please do come back. Please do tune into that show. And if you enjoyed the show, please do share it with others so they can learn the same exact things on the journey that you're on as well. Thanks, everyone. Have a great day.
Before you go, I wanted to share a personal story with you. The real reason I began to get well finally is because I figured out what was wrong with me. And that might seem pretty obvious, but I went from doctor to doctor for over 2 years before discovering at-home functional medicine lab testing. These are the labs that enabled me to finally figure out what was wrong with my hormones, blood sugar, electrolytes, and gut health. And once I knew what was wrong, I could then follow a proven plan in order to rebalance my body from the inside out. This is why I believe so strongly in functional medicine lab testing and why I've made it my mission to share these labs with the world. Now at equa.life, you can order an at-home lab test or lab bundle for you and your family and be able to complete it within the week. Plus, the EquaLife difference is that you're not left to try to read and figure out these labs on your own. We explain what your lab numbers mean, what they mean in the much bigger picture, and then how to go about rebalancing your body in order to heal. To see our full selection of lab tests, or to set up a free lab selection call to find out what labs may be best for you, simply head on over to equa.life/labs. And do remember, we ship these all over the world. To find out more and to set up your free lab selection call, simply head on over to equa.life/labs. That's EQUI.LIFE/labs.